videotaping the presentation today, just so for future use. So this will be available by a link on YouTube. Oops, let me. There we go. All right, so we'll go ahead and get started. Everybody, my name is Katie Lindstrom. I'm the director at the Pacific County Health Department, and co-presenting with me today is Stephanie Michael. There she is on the screen. She is our health programs manager for the county, and she also is our lead for the COVID response. So we wanted to just kind of go through some of the health and safety standards that are going to be required because you guys are going to be heading back towards in-person instruction soon. Actually, I think maybe elementary's already started a little bit, and then middle high school is coming up here in the next couple weeks. So just to start, go to the next slide, Stephanie.
I'm going to take this out.
So first, we just wanted to give you an overview of the decision tree. This was put out by the state, and it's what the counties have been instructed to use to make recommendations to school districts regarding in-person learning, hybrid learning, or online learning. So as a lot of you guys are aware, earlier this summer, we had put out a letter recommending that all of the Pacific County schools delay their start for at least a few weeks due to the data in the county. That data has since improved, and a couple weeks ago, we did put out a new updated letter to the schools recommending that you start looking at doing some in-person learning, specifically for elementary students first, and then kind of over time weaving in those older middle and high school students. So I just wanted to share with you quickly what goes into those decisions and where to find that data. So next slide. Oh, this is a little hard. I'm trying to admit people as I'm talking, so sorry if I'm a little distracted. Hopefully everybody gets in here pretty quick. Okay, so first of all, what we're looking at primarily is the data. So we're looking at the case rate per 100,000 over the last 14 days. If we have more than 75 cases per 100,000 over the last 14 days, we're in a high risk category. And at that point, we would be recommending, strongly recommending distance learning only, and then postponing or canceling extracurricular activities. This was the category that we were in back in July and early August. And this is the category that we made that first recommendation on. The second category is moderate risk, which would be a case rate of between 25 and 75 cases per 100,000 over the last 14 days. This is the category that we were in most recently. We were in this for at least 3 weeks before we made a recommendation. But as you can see, this is where we would start making recommendations to bring back elementary students, on an A-day, B-day kind of schedule, and then over time adding in those middle and high school students as well. The lowest category would be less than 25 cases per 100,000. And that's when you're really looking at getting as much back to normal as we can be given the pandemic. But looking at, everyone coming back in person, we still would have it be sort of on a limited A-day, B-day schedule based on how much square footage the building would have. But that low risk category is kind of where we want to be really to get back to as much of normal as we can. And then the recommendations for extracurriculars kind of go along with those. So in the moderate risk, we're still looking at postponing most of those extracurriculars. In the low risk category, we're looking at bringing some of those low and moderate risk extracurriculars back online as well. So let me admit a couple more people here. And again, one other thing that's really important to note, the health department only makes recommendations once we have had sustained data in one of those categories for at least a 3-week period. So we're not going to look at, a day-to-day jump in data or drop in data and interpret that to mean very much. We want to see a sustained data increase or data decrease before we're going to change our recommendation. And that needs to happen for at least a 3-week period. That's just to prevent a yo-yo of starting school, stopping school, starting school, stopping school. We're trying to kind of take this on longer curves so it's not so disruptive to your guys' schedules. So once you look at that data, and again, we were in that moderate yellow range for a good 3 or 4 weeks when we made that recommendation. We are now actually, I think, in the green categories. Stephanie, correct me if I'm wrong.
Correct. Yeah, we were still at 23 cases per 100,000 per 14-day
Perfect.
rolling
And that's
average.
been for a week or two at this point. So we're actually, our data at this point, everyone fingers crossed, our data is actually looking pretty good for Pacific County, especially after kind of a rough summer. So we're very hopeful it stays moving in that direction. So once we've made a recommendation about bringing back in-person learning to some extent, there's going to be two more steps that the school districts are going to need to ensure happen before you actually bring people back. So the first, or step number 2, is going to be ensuring that the district has protocols in place to protect high-risk students and staff. Also, plans in place around transportation and drop-off pickup times for students. Plans to group and cohort students. And the reason for that is really to minimize the number of close contacts that a student would have. So if there were to be an outbreak at the school, we would minimize the number of people who would potentially be exposed. They would need to have plans in place to ensure 6-foot distancing for all students and staff. So when I'm talking about the A-day, B-day schedule, that's really where that comes into play. The district's only going to be able to have as many students on campus as can fit within a classroom with that 6-foot distancing in mind. Also promoting frequent hand washing, making sure everyone's wearing a face covering all the time, no exceptions, and improving the ventilation systems. So next step. Oops, let me admit a couple more people here. There we go. All right, so step number 3. Once you've kind of determined that you've got those other safety elements in place, you're going to then make sure that the school can ensure daily monitoring of symptoms. So that's the screening that's going to need to happen either by the parents at home or on site each day for all students and staff. Making sure that the school is prepared just in case a student or staff gets sick on site. Having letters ready to go to inform families and staff in case there is an outbreak. And then the last few actually are kind of on the health department. So does the county have adequate testing available should there be an outbreak to come and do testing? And also, does the county have the ability to do all of the case investigations, quarantine, isolation, all of that case management for people who do test positive? And then finally, does the health department and the school district have mechanisms and ability and access to data so that we can make decisions based on data? So if there's a big spike in cases again and that's sustained, do we have that ability? Are we having those conversations and potentially dialing things back if needed? So once we say yes to all of those things, that's when in-person learning can resume. Next slide. So if you're interested to find out where to find this data, there's 2 ways to do it. You can do it the old-fashioned way with math. You take 100,000 divided by the county's population. It gives you a multiplier of 4.53. Then you're going to add up all of the cases within the last 14 days. That's our case count. And then you multiply the case count by 14.53. That gives you your case rate per 100,000 over 14 days. If you want to take a shortcut, you can go to pacificcountycovid19.com. On the main landing page, there's 2 data dashboards. You're going to scroll down to the second data dashboard. You're going to click on the Pacific County Risk Assessment tab, which is the tab that's selected there. This is just a screenshot from several weeks ago. Then you're going to make sure to select Pacific County in the drop-down list. And then from there, it'll show you this trend chart, which is going to show you the case rate per 100,000. And this trend chart's kind of nice because it'll show you over time where we've been at. If you can see over on the left-hand side, first of all, that orange dotted line, that represents, can you point to that with your cursor, Stephanie? The orange dotted line is going to represent 25 cases per 100,000. So you can see up until mid-July or so, we were actually below that 25 cases per 100,000 case rate. And then we took a big old spike up throughout most of the month of August, kind of dipped back down, back up, but now we're back down under that 25. It's just a nice place to look and kind of see how we've been doing over time. If you hover over any point in time on that graph, it'll show you what the actual case count is. Stephanie, do you want to take a second to just talk about what the difference between the blue line and then the dashed gray line is? Because this is a question we get a lot.
Yeah, sure. So the blue line is what DOH considers confirmed data, and then the dashed gray line is what's called incomplete. We're pretty fortunate that we're really good at getting our data in rather quickly, and so our incomplete data, that basically 12 to 13-day lag, is really on top of what our data is. So you'll see very little change between that blue and gray as it turns blue and gray as it turns blue. So you can use that as a pretty good indicator of where we are. And as you scroll over it, it will tell you, and usually it's about 2 days behind. We also provide this data during our school working group on Monday, as well as on Wednesdays, whether it's posted on our Facebook feed or as part of our community forum. So you can do that. You can also always call into the EOC. We can give you that data if you'd like it right at that time, and going there. And then maybe Katie, there's a bunch of questions. We wanted to maybe stop and take a moment to take those first.
Sure, let's do that. Let me pull up the chat. Okay.
The first one is the case rate per 100,000 interpreted with consideration for actual number of tests that are being administered in those weeks. So really, we're looking at what our testing capacity is, vice what is actually being tested. We are still people just need to give a phone call to figure out where they can get tested. And that's what we're still able to meet the testing need. We haven't expanded, beyond what our means are at this point. In fact, we're probably doing more testing and supporting our neighboring counties because we haven't had people symptomatic or close contact that need the testing. So it's more about our testing capacity than just the tests that are being performed. And again, we're asking anyone have a symptom or if you've been identified as a close contact to get tested. Let's see.
I would say early on, back in like March, April, there were some glitches with the state system and how they're allocating tests. And early on, Pacific County was not testing as much as we should have been able to. It was due to not having the supplies. So early on, I think you could probably make a case for some of our low case rates may have been because of lack of testing, but that's definitely not the case anymore. We're very confident that anybody who needs a test can get a test at this point.
Hey, I asked that question and I could just follow up. I understand your response about testing capacity, but I don't think testing capacity is the issue. It's great you have a lot of tests. The question is, how many of the tests are being done each week? Do you take that into account when you float that blue number up and down above 25? If you have very, very few tests within a couple week program, then time frame, then you're probably going to have a low number just based on low tests. So do you track the number of tests as well?
We do. And actually, so this slide here, and it'd be great if we could be on the actual website because we could show you where to find it. This slide is just showing trends of actual case count. So you're right. It definitely could be influenced by having a lot more tests given or not given in a week. I think what you might be looking for is our test positivity rate. It's another metric that the state uses where you take the total number of tests and you're trying to figure out what percentage of those are positive in any given point in time. And the goal is for us to be below 2% positivity rate, which indicates a couple things. Number one, that we're doing adequate testing, and also that the COVID activity is at a reasonable level within the community. So if you do go to that COVID-19 webpage, PacificCountyCovid19.com webpage, you can click on, I think it's the testing capacity tab. I know it's very hard to see, but there's a testing capacity tab there, and it'll show you total number of tests given, within the last week over the whole entire time, the number of those that are positive, and then it gives you that test positivity rate as well.
Okay,
there's a lot of data. These dashboards are actually pretty useful. A lot of different data for anyone who's interested in diving in on that. All right, next question. Most residents in South County shop entirely in Clatsop County. Clatsop County has 104 cases in the last 5 days. With the very low numbers of individuals testing in South County, how can we make certain that our numbers are not following Clatsop County? We do believe that we have adequate testing in South County. We also, I believe, Stephanie, at this point have confirmed that none of the cases, the recent outbreak at the Pacific Seafood, I believe we've confirmed that those are not, none of those were Pacific County residents. Is that
To
correct,
the-
Stephanie?
To the best of our ability with Clatsop Public Health and Oregon Health Authority. So we've been in contact with them since last week, Thursday, when we were notified of this outbreak across the river. And so that's really been our constant every day. Anything for us yet? We know that other counties have been notified. And so we're thinking that hopefully we've dodged that bullet. We'll see. I do understand the point, though. You're saying, people going over into Clatsop County and that potential exposure. Again, it seemed like most of the workers on, especially the night shift, are visa workers. And so they're on work visas and they stay in lodging that's provided by the Pacific Seafoods in Clatsop County. So just kind of that interaction within the community. Again, another just highlight for the importance of only traveling when necessary, right? That's the guidance we've been putting out since March. And then in your interactions, keeping them, again, with mask on, social distance, going into stores, going in, getting your stuff, going out, not lingering, not hanging out and interacting with people. So that's the piece of what we need to do to really kind of continue to limit spread.
Great. Okay, so next here we have is, should we be testing everyone who is being sent back into buildings, including students? If no, why not? We get this question a lot. I think in an ideal world, there would be plentiful testing supply for everyone who's asymptomatic, and you could test before anyone did anything. It's just not the scenario that we're living in. Tests are basically reserved at this point for people who are either symptomatic or they could be asymptomatic, but have been identified as a close contact. One of the reasons that asymptomatic testing is not prioritized right now is because it can provide a false sense of security. First of all, if you get tested, that test is only good for that moment in time. You could literally go and be exposed an hour later and now potentially be an asymptomatic carrier. And you're you're walking around with a false sense of security that you're negative. So that's one issue. Another issue is, I'm sorry. That totally slipped my brain. The other issue. So with school, what the real gold standard is in terms of ensuring that people aren't coming in and infecting others is screening, and then also the mask wearing. And we're going to talk about a lot of those safety precautions here during the presentation. So we will cover a lot of that. And we will talk about how we really can reduce that risk down by implementing those safety precautions. But at this time, we don't have the resources to do testing of everybody every day. All right. Question is around adequate access to testing. Can you let us know where we can get tested? We absolutely can. We actually have a slide on that. So when we get to that part of the presentation, there's a slide. We will share this presentation with Amy. She can get it out to you all so you can have it in printable format as well. Where can we get the rates separated from North County to South County, since our district is only going by the South County numbers? Notice today there were 2 new cases and 3 presumed. Are you counting presumed in your numbers? We internally count presumed in the numbers. The state data is not going to show presumed, though, until those are confirmed. In terms of north-south, we can't split those out on a case-by-case basis, but we do once a week split out the total case count by North and South County, just to show the rates of COVID. Since this has started in the different parts of the county, it's actually split out by zip code. So we can share that with you guys. All right, I think that's the last of the questions. Yep. Okay, so let's move on to the next slide. This is just to show you that same data, but kind of with the overlay of that low, moderate, and high risk category to show where the county has been over the last several months. So moving on. And this is that was the slide that we do share with superintendents each week. So we could get that to any of you all as well if you'd like to have updated data on a weekly basis. Face coverings. So first of all, face coverings are going to be mandated for all students and staff who are on school property at all times. So that includes volunteers, parents coming in to pick up kids, obviously staff and students. There's very, very, very limited exceptions that could be made for students with certain disabilities or other specific situations. In that case, those students would be accommodated with a face shield. But again, it's a very limited case-by-case situation. If a student is unable or a staff is unable to wear a face shield or a mask, they would need to be accommodated with online learning at that point. There's no accommodation to just let people not wear masks or face coverings of any kind at school. And then of course the district will provide those face coverings for anyone who doesn't have them, and they need to be sanitized and washed between uses. Next slide. So if a person is accommodated with a face shield, it's really important the face shield doesn't have a gap up at the top. It needs to go down below the chin, and it should be worn with a cape that seals in that area between the chin and the shoulders. The couple exceptions that I had mentioned, obviously children under the age of 2, anyone who's incapacitated or wouldn't be able to take a face mask off on their own would be exempted. And then people who are deaf or hard of hearing may be accommodated with a face shield, just in terms of, being able to lip read and that sort of a thing. Let's see. Even when cloth face coverings are worn, people still need to be doing proper physical distancing. And students would be allowed to have mask breaks. Those would need to happen outside and far away from other students. That needs to be something that's set up and arranged specifically within each building and monitored to make sure that there is the proper distancing and people being outside is happening for those mask breaks. Next slide. So kind of the why on face coverings. The big thing with face coverings is that face coverings are meant to protect the people, not necessarily the wearer. There's some level of protection that you get from wearing a face mask, but for the most part, what the purpose of the face mask is to prevent your droplets and your germs from getting out. So when I'm speaking or singing or talking loudly or sneezing or coughing, micro droplets and droplets are coming out from my nose and my mouth, and they are lingering in the air. Some of the big heavy droplets drop down to the ground fairly quickly, but there's a micro droplets that can sort of linger in the air. So by wearing a cloth face covering, we're stopping or blocking the majority of those micro droplets and potential germs from getting out and infecting others. So that's really the reason we wear masks. If you're looking to protect yourself with the mask, that would be an N95 situation. And those are really reserved for medical professionals and others who are doing procedures where there's a real risk. Maybe they're working on a person who actually has COVID. So anyway, we get that question all the time. And people are, I think, get very confused about the purposes of masks, but they really are about protecting others. So I'm going to go ahead and let Stephanie queue up a video here, and it's just going to do a little demonstration to reiterate that point.
Well, last week, Washington State put a mask mandate in place requiring individuals to wear a face covering in indoor spaces, and also requires face coverings outdoors when people can't stay 6 feet apart. The mandate is in place to prevent the spread of coronavirus. Well, there's still a lot we don't know about this virus. What we do know is that it spreads through droplets. So we wanted to know, how effective are masks when it comes to stopping them? Our Kevin Kim got an exclusive access to a lab in Spokane to test it out for himself. Full disclosure, this demonstration just looks at droplets, not specifically the coronavirus. But if you keep in mind how this virus spreads, the results may surprise you.
From blue polos to blue lab coats and gloves, we headed down to Sacred Heart's laboratory to unmask a common question. What exactly does a mask do? So we teamed up with the hospital's microbiology director, Dr. Rich Davis.
This one will be no mask. It's a demonstration of where respiratory droplets go and how easy they are to transmit, and how a mask is effective at blocking those. That's really the key takeaway.
Here's how this demonstration worked. I had a petri dish in front of my face as if it's another person's face. Then, with and without a mask, I talked.
Hey, how you doing?
Sang.
Somebody once told me the world is gonna roll me.
Coughed. And sneezed. We also tried coughing with and without a mask from 2 feet away, 4 feet away, and 6 feet away. Dr. Davis put the dishes in an incubator, and we waited 24 hours for our results.
So these are the plates that you were interacting with yesterday with or without a mask.
Let's start with the face-to-face demonstration. Mask on the left, no mask on the right. Let's go with talking first.
With a mask? Oh, that looks good. Talking without a... Oh, okay. I'm actually shocked there's any at all. I'm going to be completely honest with you.
Next up, singing.
This was Changes by Tupac, and this was Smash Mouth. Things will never be the same, never be the same, yeah.
Pretty similar to talking. But Dr. Davis brought up a good point about one of nightlife's most popular activities.
Like karaoke night, when that microphone after the night, I'm sure it's pretty gross and wet. So now we've got coughing. So this was just two coughs.
Really? That's crazy.
Remember, all those yellow dots, that's where bacteria grew after the droplets out of my mouth landed there. But those droplets were nothing compared to the ones from sneezing. First, mask on.
What? Okay, I'm terrified to look at this one. This is no mask. Ooh. Oh. Good Lord.
When I had my mask on, no yellow dots. But when I didn't, there was always something.
What this kind of goes to show is that most of those, heavy fat droplets that are going to come out of your mouth that are going to have bacteria, they're going to have viruses potentially, they're going to get caught and not go forward into, the space in front of you.
It was the same case for the social distancing demonstration.
So yesterday I was standing right here.
No mask, with a mask, 4 feet. You can see it's less, but still pretty prevalent. 6 feet.
Oh, okay.
Yeah, just one or two few up there. So there really is that distance difference where the droplets that you're producing by coughing are pretty much, a lot of them are falling out of the air. To me, I think we're coming into a new reality where masks fit into that very social conscious paradigm. You do simple things that everyone can do. It's not going to be 100% effective, but if we all do it, it's going to definitely make a difference in preventing things from spreading one person to another.
Very.
All right, thanks, Stephanie. And I just want to add on to that point there at the end. The safety precautions that we're going to talk about, social distancing, mask wearing, washing hands, cleaning, all of that, every single one of those things is very important. None of them are 100% effective, though. And so what we're really looking at is we're really looking at the layering of strategies. When you're wearing your mask and you're social distancing and you're washing hands and you have good ventilation in the building, and all of these things are happening together, they combine to create the lowest risk environment possible. So it's really important that we're doing all of these things. Each individual strategy is effective, but much more effective when done all together. I'm going to take a minute to answer some of these mask questions. So I should have said there is an exception to the mask wearing when the students are physically eating. So if you have a half an hour lunch, the kids could take the mask off during the time where they're actually eating, but they need to be put back on as soon as they're done eating. So if lunch continues for another 10 minutes after they're done eating their food, they would need to be wearing masks for the remainder of that lunch period. It's not just a 30-minute break of no masks during the day. Let's see. So, and then mask breaks. So I should clarify also on mask breaks. It would not be a situation where you would say recess is a time for mask breaks because it's outside. And then you just tell the kids to stay 6 feet away from each other, because we all know that kids are probably not going to listen to that. They're probably not going to be real good about staying 6 feet away from each other just because you said to. So mask breaks are more of if you have a student who's really struggling and needs to take a break during the day, where they would go out one at a time kind of for a mask break sort of a situation. So there wouldn't be that temptation to be interacting with other kids or other people. So that's really what we have in mind with mask breaks.
Katie, we are doing group mask breaks, just so you know, but like we can spread them out more than 6 feet when we do it.
Yeah, more than
around
6
the
feet is
edges of a
definitely good.
field or something like that.
Okay. Yeah. I mean, if it's monitored and you can ensure that, it's really important though. You're not letting people mingle closer than 6 feet, and 6 feet really is the minimum standard. All right. High school has old ventilation. We're going to talk about ventilation here quite a bit actually. So I'm going to hold that question until we get to that slide. Go ahead and go to the next slide, Stephanie. All right, so this is just to kind of show you, again, when you're layering a couple different interventions together, how your risk can go from very high to virtually none. So this is showing when you're doing physical distancing and mask wearing in different scenarios. So the left-hand side, you have a person with COVID. On the right-hand side, the blue person is a healthy person. First scenario, neither person's wearing a mask and they're closer than 6 feet together. Odds are very high of spreading COVID in that situation. Second situation, the person who is sick is not wearing a mask, and the person who is healthy is wearing a mask, and they're closer than 6 feet together. Again, this is a high chance of spreading COVID. Again, you want the person who's sick to be wearing the mask. The person who's infected, that's the most important person to be wearing the mask, because you want to keep those germs to that person's self. The medium risk category is going to be when only the person with COVID is wearing a mask, but the other person's not. They're still within 6 feet of each other. Now you get down into low risk category if both people are wearing masks and they're still closer than 6 feet together. It's very low when you're layering both of those strategies together. You've got the mask wearing and the distancing. Now we're to very low. And then of course, if you stay home, virtually none. Next slide. I think we already talked about this a little bit, but these would be some of the feasibility and adaptations that could be made. Again, people who are deaf or hard of hearing, some students with intellectual or developmental disabilities. These are examples of times where it may be appropriate to accommodate with a face shield instead of a cloth face mask. Your preschool students would be another area where you would look at some exceptions potentially. And then if people are engaged in high intensity activities, one question we're getting a lot from the schools is what does that mean for PE? And the recommendation currently is that PE is adapted to include only activities that don't require excessive exertion. So potentially not doing running, maybe instead, I don't know, some lower impact PE type activities. Also PE type activities where kids can space out a little bit so that they can still wear their face masks during PE. Next slide. If students will not wear a face covering, I mean, the school should do everything they can to try to work with that student. Again, if there's a reasonable reason for an accommodation, could look at a face shield. If it really comes down to it though, and kind of as a last resort, the student could be excluded from school and required to do online only if it comes down to it. Again, there's no exceptions for people who just don't want to wear a mask. It needs to be a very specific and valid reason, even just to get to the face shield. But there's really no exceptions around wearing at least something on your face. Next screen. Just some tips to help kids get to wear masks. I think you guys are all middle high school, so kind of older kids, but I think sometimes we assume kids understand all the stuff that's going on. So there's always value in explaining it to help them understand the why behind wearing the mask and the other restrictions that are in place. Giving the kids a choice, obviously fabric, kind of make it fun, let them decorate their masks. Having them practice, I guess, just not assuming that all students know how to do this correctly, especially taking them on or putting them on and taking them off without sort of getting the germs all over their hands. And then being a role model, of course, wearing your own mask, they'll emulate what you're doing. Next slide. All right, so the next strategy here, this is a very important one. This is mandatory. There has to be screening and symptom check every single day for every single person who is on campus at the school. Students, staff, teachers, anyone who's going to be exposed, who's going to be at the school needs to be symptom screened and checked. I believe, Amy, you guys are going to use the Qualtrics app with parents?
Correct.
Okay, and then will a paper attestation form be available as well for parents who don't have phones?
Yes, yeah.
Okay, so ideally, all of the parents do this screening at home with their students, and the students come to school already screened. The screening includes asking a list of questions, which will be on the next slide, and then it also includes a temperature check. For students who come to school without having had that completed by their parent, it will need to be completed on site by an adult. Staff also need to be screened every day. However, they can screen themselves. So you'll be able to just sign off on a form or on a sign-in sheet attesting that you don't have any of the symptoms. Go ahead and go to the next screen. actually go ahead and go to the next screen. This is just basically saying people are not allowed on site if they have any of the symptoms. This is the actual screening set of questions. So whether it happens in Qualtrics or on a paper attestation form, these are the symptoms that you're actually screening for. If people say yes to any of these questions, they would need to be screened out for that day. They wouldn't be able to be at school. So of course, the first chunk is just those symptoms. And then also asking anyone in your household has symptoms, or has anyone in your household or the student been in close contact with anyone with suspected or confirmed COVID. And then an important thing to note when we're talking about a fever, if you have a fever over 100.4, you're excluded. If your fever is under 100.4, but that's because you took Tylenol, you would still be excluded. So you need to not have a fever.
Actually, today.
I'm sorry. Did you want to say something else?
How are you doing? I'm only listening to this. I'm not like, oops.
Okay, I'll go ahead and keep going. So again, it needs to be a no fever, and because you cannot not have a fever because you took Advil or Tylenol. So medication free. Next screen. Stephanie, you want to explain this one? It's sort of the decision tree on if you should come to school or not.
Sure. Okay. So again, this is a really good graphic. I would highly suggest people have this printed at home, printed at place of work, just again, so you kind of can understand where anybody might fall and what that exclusion might look like. The first column obviously shows a flow of there's no symptoms, no diagnosis, meaning they haven't been diagnosed with COVID, and then no close contact exposure. So they're free to be in the school environment as a staff or as a student. However, as we start, having people identified as close contacts, as we have for the past, 9 months or so, 8 months, those persons are going to be excluded and should be at home in quarantine for 14 days. We have cases that they're a close contact and they don't start showing the symptoms until day 14, and they have initially tested negative. And so it's, again, really important that full 14-day term is being applied to those that have had exposure and are considered a close contact. The third is no symptoms, but have tested positive for COVID. We know that 40% of people are asymptomatic and carriers of this disease. So it's important that they will also be excluded from school, and they usually are for at least the 10-day mark from the positive test, because we usually go off of symptoms, but in this case, they don't have any symptoms. And so we go off of the test for that incubation and transmission period. The last two kind of here are when people are experiencing symptoms. And again, you'll see over to the right, there's a long list of symptoms there that can be attributed to other illnesses as well. The first thing is when you do have a symptom, the test is what's going to be helpful in determining that further on action. So if you do have a symptom, they do test positive, you will not be going to school. Oh, sorry, I'm in the negative column. Testing negative, again, is more likely something like what we call another influenza-like illness. And so they need to have 24 hours from the time that their fever has resolved without medication and their symptoms have improved, and cannot have been a close contact to a positive case. That is what gets people back into the school environment or the work environment for that case. And then on the last column, you'll see here, symptoms are there, but they tested positive or they did not test, which is basically not helping us move them in any other sort of mechanism towards getting back into school. So they will have to, again, be out for at least usually 10 days from that symptom onset, and include a 24-hour period of the fever has and their improvement in symptoms. So this should, again, it should cover every scenario, and it's a really useful visual chart to be using with those symptoms listed, as well as kind of that definition of close contact, because out of every positive case, we obviously get those close contacts associated that have to go into that quarantine as well. And so those are kind of those mechanisms there that you can see on this flow chart.
And just so y'all are aware, our public health nurses manage all of the quarantine and isolation cases. So that would either be people who test positive or their close contacts. They're under a public health order to quarantine and isolate. They really shouldn't be and hopefully aren't leaving at that point. We do call and check in with them every day. Once they're released from quarantine or isolation, we do give them a letter. So basically, it's sort of up until now, it's been a return to work letter for employers to know that the person's safe to return to work. But that's something that anyone who's been released would be able to hopefully produce if needed. All right, next slide. Okay, since let's answer the questions on screening since we're moving on to the next section. So if someone fills out a form and it's proven the form has false info, is there any ramification both for students and staff? Gosh, I feel like that's a legal question for legal people. I mean, the parent is signing and attesting each day. I would hope that there'd be honesty. I'm not naive enough to think that there could potentially not be honesty. I don't know, Amy, do you have a thought on that?
We're trying to just push the idea that one day of convenience is not worth 14 days of quarantine. Because if they get sick at school because their parent lied about it, then they're going to be out for 14 days because we don't know if they've just got a cold or what.
Yeah, and I will tell you, if a student, let's say they come to school sick, or if they develop symptoms while at school, they will be isolated at school and sent home. So there is not an option just to stay at school while ill. And hopefully there won't be exposure kind of during the time it takes to figure that out. And then do we have a holding area for students who arrive but fail the screening? Hey, good question. So yes, the school is going to need to develop an isolation room for anyone with symptoms, basically. And that'll be a place where a student can go while waiting for the parent or whoever to come pick them back up from school. If it's a staff person who develops symptoms while at school, they would just need to go home like right away. So that would be the instruction. All right, moving on to hygiene practices. Next slide. Oh, did I miss? I'm sorry, I missed some questions. I did not even see that scroll down. Okay. There's a quarantine room. Yes, we do. Where's the closest place someone can get antibody tested? I believe some private providers are offering antibody testing, so you'd need to talk to your private provider. I've also heard that if you donate blood through the Red Cross, they will do antibody testing. Stephanie, anything else I missed?
Oh, those are the only ones I had.
Yep.
Thank you.
Okay. All right, so moving on to hygiene practices. So number one hygiene practice is stay home if you're sick. Just stay home. Don't expose other people. And then probably second, number two, hygiene practice is wash your hands. I don't think there's much you can do to protect yourself more than washing your hands. It's not the primary way that COVID is spread, but it is possible that you can, somebody with COVID could sneeze on a surface, you could touch that surface and then touch your face and you could infect yourself that way. So you're going to prevent a lot of that kind of spread. Again, it's more rare, but it can happen. You're going to prevent a lot of that spread by washing your hands often before school, when you get to school, before lunch, before and after using the bathroom. Just wash your hands even more than you normally would. And we're going to want to be making sure that we're really helping kids and educating kids about the proper ways to wash hands. You really need to do it for a good 20 seconds, lots of water, lots of soap, lots of, getting in between the fingernails, in between each finger. It's not something that everyone sort of innately knows, and you'd be surprised how many people do not wash their hands thoroughly or correctly. So want to really be looking at teaching kids the correct way to wash hands and providing lots of opportunity for hand washing throughout the day. I don't know, are you guys using hand sanitizer at school? Amy, is that something that flies at your school?
Sorry, what was the question?
Hand sanitizer?
Yeah, we've got lots of it.
Okay. All right. And then, of course, we also want to teach students to cover their coughs and sneezes, either coughing into their elbow or into a tissue. They need to also be wearing a mask. So they should be coughing into their elbow while wearing a mask. So it's sort of a double protection. And again, don't assume that kids know how to do this stuff correctly. It's important that we actually teach them. Next slide. So this is just, I won't go through this, but basically just the steps of washing the hands. The next slide is just an example of one of many things you can post kind of behind your hand washing sink, just to kind of sing in your head. It gives you an idea of how long 20 seconds really is. It's actually longer than you think. So next slide. All right. Do we have any? No questions there. Okay, good. So physical distancing, this is the next of the strategies, again, that we're going to be layering to decrease our risk. We'll start out with a video on micro droplets to show how COVID spreads through the air.
About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the micro droplets, shown in red, continue to drift. This simulation uses only micro droplets. 5 minutes later, 10 minutes later, 20 minutes later, the micro droplets are still floating in place. But there is a way to prevent this stagnation of micro droplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, micro droplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクというのはかなり下げることができるようになるんじゃないかなというふうに思います。
Okay, and I've already seen there's a question in there about the windows. So I think the important thing to know is it's about airflow. So windows, having 2 open windows in a room would be one way to do that if you don't have a ventilation system that can take care of it for you. I do understand that there's some ventilation systems that are designed to circulate fresh air in and pull bad air out. And if you're in a building that has that sort of a system, that would serve the same purpose as the window opening. So it's really probably more of a question for your whoever's in charge of your ventilation system. But if you do have a ventilation system that can do that and can circulate that fresh air in, it's going to be serving that a very similar purpose to what we just saw in the video. Oops, I can't hear someone asking a question. Okay, so I see a question here. Do air purifiers help? The answer to that is yes, they can help. I bought an air purifier from Costco and I keep it in the room with me. Air purifiers do, I think they do provide some additional protection. You want to get the kind with a HEPA filter if you can. So yeah, that is another option. I can't answer your guys' question specifically on ventilation in specific buildings. I am under the impression though that you do have one of those ventilation systems that can kind of that circulates the fresh air. Amy, is that correct?
Been asked to go through.
Christian, talk about ventilation.
So our middle school has more than adequate ventilation system in it. It's been updated and upgraded, and I've been continuing to work on reprogramming that so that it's even more sufficient. Our high school, we just made adequate in our classroom areas. It wasn't prior to this, but it does have fresh air that will come in through the units that are on the wall. And then we have ventilation that we added to the ceiling.
I do believe you can increase ventilation also with fans in your room to kind of, as you saw in that video, you can kind of blow those micro droplets away. So if you have fans facing kind of strategically to blow those micro droplets away from the area where people are going to be, that could also be a useful tool.
That'll create a vacuum system and draw the air droplets across bodies when I've got a ceiling mounted ventilation system, which is what we have in every room in all of our buildings.
Okay, so yeah, again, I'm not a ventilation expert, but it's a good thing you guys have the ventilation system that's going to take care of that for you. I will tell you, when the kids are on buses, which probably won't have a ventilation system like that, it would be important, as weather allows, to have windows down in those situations while the kids are on the bus. All right, next slide. All right, this is just to kind of show the chance of infection or transmission with the intervention versus without the intervention. So this one is showing physical distancing, about a 12.8% risk of infection when there is not distancing happening. And there's about a 2.6% chance of infection if distancing is being observed. So it's very effective. And then you add on the mask and you really start becoming, it's very effective in reducing our risk. Next slide. So just physical distancing, kind of the policy for the school. The school needs to do what they can to increase space between desks. Again, it's a minimum of a 6-foot radius between students and staff. That will determine the size of classes and the number based on how many kids can fit in the classroom with that 6-foot radius. Field trips, assemblies, other large gatherings should be canceled. Suspend or make significant modifications to any activities that are considered high risk, things like choir or other classes or activities that require students to remove their face coverings. Those are the things that you're going to want to cancel or postpone. Reducing the number of students in the hall at one time. This can be achieved by staggering release times for different periods. Also, looking at staggering arrival or dismissal times potentially, so that we're decreasing the number of people getting on and off buses or getting dropped off all at the same time, or at least having strategies in place to really spread that out so that the kids aren't coming in crowds. Next slide. This is a big one. You're going to want to really reduce the congestion in the health office, and you're going to want to have one designated area for people who may be sick or with symptoms, and then one designated health office area for students or staff who just need a Band-Aid, who come into the health office, but they're not sick. You do not want them intermixing and in the same area where kids who are sick or with symptoms are or have been. You're also going to want to limit any non-essential visitors. Unfortunately, this includes kind of classroom volunteers, parent volunteers, that sort of a thing. Limit any cross-school transfer programs, of course, because again, we're trying to limit the total number of students that are mixing with each other over, in any given day. And then also it's important that we're teaching staff and any students, parents, any visitors of the importance of distancing. Have physical markers on the floor to really highlight what that distancing is, making sure that all of this health and safety guidelines are enforced with anyone who comes into the school. The students and staff, I think, will probably get used to it and they're going to learn it. But you get a parent coming in and it's the first time they've been there all year. They need to also be following all of the health and safety guidelines as well. And then a big one, and today's a beautiful day for it. I know where we live, so I know this isn't always possible, but as weather allows, do as much as you can outside. Take your class outside. Being outdoors significantly reduces the chance of transmission. Next slide. Meals. My understanding is you guys are going to be eating meals in the classroom, correct? So again, you want the students to be wearing their masks for all time, except for when they're actively eating, because obviously they need to take it off to eat. But we want to reduce the amount of time that they're not wearing a mask. Grab and go meals, brown bag meals, individually plated meals. Those are all the things that you're going to want to look at. You don't want students touching utensils, so no student serving themselves. If you were in the lunchroom, you'd want to look at the flow of the lunchroom, make sure you have, students all walking in one direction, making sure that during meal times that students are still 6 feet apart. And of course, we're cleaning and sanitizing, between meals. again, if you're in the classroom, that's not going to be a kind of between groups, but kids should be sanitizing their areas before and after meals. And then also, at the end of the day, we're going to want to really heighten our cleaning this year. Next slide. Transportation and drop off. So I had already mentioned that we want to increase ventilation on the buses as much as possible. So having those windows open is going to be important. Students have to wear masks and staff have to wear masks even while on the bus. We're going to want to be looking at increasing cleaning, especially of high touch surfaces. So the backs of seats, the handlebar as you walk up into the bus, any of those surfaces that get touched a lot, those are going to need to be sanitized between rides. Students should be sitting either with members of their family or members of the classroom that they're going to be in during that day on the bus. Because we're trying to decrease the total number of interactions students have with other students. So if they're sitting with family members or other classmates, those are kids they're going to be mixing with anyway. So that's how you should really be arranging seating on the bus. When possible, having space between students. So an empty space between students if possible. Encouraging any kid who can to walk to school or, obviously parent drop off is also great. And then consider rerouting or looking at your bus routes to ensure that the furthest pickups and drop offs have the fewest students on the bus. So we're trying to decrease that amount of time where kids are together in an enclosed bus area. Okay, next slide. Cleaning and disinfecting. Go ahead, next slide. So we get a ton of questions about how long does COVID live on different surfaces. As I've already mentioned, it's the primary way that COVID is spread is through the air. However, it can be spread by, again, touching a surface that's infected and then touching your face or your eyes. This kind of shows just some different examples of how long COVID lives on different surfaces. So again, the most important one really is air. COVID can live in the air for up to 3 hours. COVID lives on copper for 4 hours, cardboard for up to a day, stainless steel and plastic for up to 2 to 3 days. So those are kind of the most concerning ones. It's where it can really live for a good amount of time. This was published in New England Journal of Medicine. So if you're interested in the whole study, you can follow this link here. And actually the next slide is going to show kind of how virulent the virus is over time on those different surfaces. So it shows that obviously when the virus first lands on some plastic, it's going to be more infectious. And as time goes on, it becomes less effective or less infectious. So you can kind of see what that the life of the virus is on those various surfaces with this chart here. Next slide. How to clean and disinfect. This one's important. We are going to want to increase our cleaning and disinfecting standards. One of the first things to know is that most household cleaners, most things that you can find at the store are going to be effective at killing COVID. However, you need to make sure that you're using those cleaners correctly. So for example, if you have some 409 or like a Clorox wipe or whatever it is, you're going to want to make sure you're reading the instructions on the back. And if it says that you squirt the 409 on the table and you let it sit for 30 seconds before you wipe it off, you need to make sure you do that. The instructions to a T. You need to let it sit for 30 seconds and then wipe it off. If you're doing it too fast or you're not following the directions, then it's not going to be effective at killing the virus. So that's one important thing to remember. A solution of bleach and water is also a good backup if you don't have a fancy store cleaner. Let's see what else. You want to make sure that your area is well ventilated when you're cleaning, having airflow, windows, whatever, while the cleaning is actually happening. You don't want to use fogging or fumigation systems. Those can actually harm people. It can irritate the lungs. Generally speaking, the cleaner that you're using, it'll say what it's effective at killing on the back of the bottle. And most of the ones that say, kills 99% of household germs and bacteria, those are going to be effective against COVID. So next slide. So it's just some specific things to really think about with cleaning is pay special attention to any high touch surfaces. So things like door handles, any buttons that people might push, the countertop, like in the office, windows that are being opened and closed, anything like that. Those are the high touch surfaces that you want to have cleaned. I'd also recommend having kids clean their area each day at the end of the day. Shared restrooms are going to be an important area to have increased cleaning. You really shouldn't probably do public drinking fountains or bottle fillers. I'm not sure if that's something you guys have, but we'd probably recommend you not have those. It's a little bit difficult to maintain the cleaning on those throughout the day, just given how much those would be used. Next slide. Other is electronics, so keyboards, anything that's shared at all. If you have kids sharing Chromebooks or anything, they need to be wiped down between uses. Athletic equipment is the same thing. You need to wipe the basketball down or whatever shared equipment is being used between uses. We've already talked about buses. Playgrounds are another. If there's playground equipment, that should be cleaned on a regular basis just to ensure, clean playground equipment between kind of groups of kids going out to recess. Next slide. Laundry, generally speaking, washing clothes just in a regular laundry cycle is going to kill COVID. Obviously, you want to use as hot of water as possible. Bleach if the fabric will tolerate it. If you are cleaning, and let's say you're cleaning and you're doing laundry after known COVID has been kind of on the material, you're going to want to make sure that you're wearing proper PPE while you're doing that laundry. You don't want to shake laundry out because that could aerosolize any virus that might be on the fabric. And wearing gloves and potentially a mask while you're doing the laundry would be important. And it is really important that we are washing masks daily. Kids should not be wearing masks that had been used from a previous day. We need to have clean masks each day. That's not next. Next slide. We've talked about ventilation a lot. So the ventilation, there's kind of two ways around this, right? Or there's several ways, I guess. The main idea is you want fresh air coming in and bad air going out. So whatever your system, however it's set up, you just want to make sure that that is what is happening. Again, if you don't have a ventilation system that'll do that, windows will work. And then there's certain specific filters and different recommended equipment that can increase kind of that safety. So again, I would talk to your ventilation people at the school for more information on this. It sounds like you guys have an adequate system from what I've heard. All right, next slide. If you really want to dive into this, there's a lot of information on cleaning and disinfecting. Here's some, again, we'll give you guys send you guys this slide set so you can click on these links. But these are some different recommended resources for more information about cleaning. I'd really recommend that third one down, CDC Interim Guidance for Administrators of U.S. K-12 Schools and Childcare Programs. It's going to be really specific and go into detail on cleaners that are safe to use around kids, things like that. All right, next slide. All right, let's take a break to answer questions before we get into this next section. So I just want to make sure there's not. Okay, in the cafeteria at the high school, students should be seated facing in the same direction while 6 feet apart. Was that an answer to somebody's question?
I believe it's a question if they should be facing the same direction.
Right. They're going to be, that was mine. They are going to be eating in the cafeteria at the high school and a couple other areas where they have a marked seat. But you were talking about how everyone should be going in a line and flowing in one direction. Should they then be seated so that they're not facing one another when they're eating as well? Because they'll all be at seats in the cafeteria 6 feet apart.
Yeah, I don't think it'll be necessary for them to be seated in the same direction. It's more about when they're entering into the cafeteria, you don't want a lot of congestion. So thinking about having sort of a one-way where people all walk in one way, go get their lunches, and then all exit out one way, just to avoid cross traffic. But once they're seated, as long as they're 6 feet apart, I don't know that it matters which way they're facing necessarily. But good question. All right, are N95 masks still in shortage? If not, can staff get them? Are KN95 any better than 3-ply surgical masks? So I'm gonna let Stephanie answer this. She's a mask expert for the county.
Sort of. So the biggest thing is like the usage of masks for their assigned requirements. N95s are really meant to be used when aerosolizing procedures are being done, and people are directly in face of people like healthcare workers. And so that's really what the recommendation is, the mask used for the intended purpose. I'm not saying you can't have your own N95. I will say though, you know, listening in on hospital calls and those types of things, it's still kind of difficult to get large quantities of these types of PPE. And I expect that will only continue through the flu type season and how we go into winter. On the other side of that too, if you're wearing an N95, it's really not a valid, secure mask unless you've been what's called fit tested, and that's usually done at a hospital or at emergency medical service person that's qualified to do those fit testings. That really requires to make sure that that N95 is truly suctioned around your face. I don't know if you've worn N95s before; they're not comfortable. Doctors do it for their 12-hour shifts and things like that, but it is not a really comfortable mask to be in. And if you're not in an aerosolizing procedure, I wouldn't put yourself into that situation. The 3-ply surgical masks are considered a good standard when we're looking at face coverings. And then the KN95s, we don't use them in the medical side grade of things, but you could use those. Some find those actually to be more comfortable and kind of just a face covering, but not truly to the effect of what a N95 should do.
Thanks, Stephanie. All right, is the plan still for fogging to happen on Wednesday? Is it effective to use when no one is in the building? Yeah, using the fogging machines and foggers I know the recommendation is to not use those if people are around or if they're going to be potentially exposed, because it can irritate the lungs. But I'm not sure if it's something you set off and then everyone leaves the building potentially. Amy, I don't know what your plans are with the school.
That'd be Chris, and I don't think we're fogging.
I am not.
Okay. Yeah, we wouldn't necessarily recommend the fogging at this point.
And you missed a kind of a question right above the KN95, N95 question.
Oh,
It's
I'm sorry about that.
grouping.
Okay. So as at the high school, we'll
High schools can't cohort the same way, so they're asking about recommendations.
So what recommendations do you have for cleaning surfaces, desks, they're moving between rooms? I mean, I think if you can, I'd have kids wipe down their desks as they leave, before they leave. I think that would probably be your best bet. It's a tricky one. I know with high school kids, it's a lot harder to keep them all in the same classroom all day, you know, like the younger grades. But I think for top safety, I think you want to maybe have them wipe it down. Do you have the materials to do that, Amy? Clorox wipes or a I don't know.
The teachers
cleaner.
have top cleaner that could be used.
Okay. Yeah, and I'd recommend as much as possible having the people who were sitting there cleaning their own areas, just to, limit that potential exposure. Okay, did I miss any other questions? Fogging. If we're bringing kids back for in-person instruction, special ed, are we supposed to stay home on Wednesdays and work so deep cleaning can be done in our rooms? That is an Amy question.
That is up to Chris.
Again, no, that doesn't have to happen.
Okay.
We are not fogging on Wednesdays. We're not fogging unless if we have an outbreak at one of the schools and we absolutely have to, so that we can get the areas that we couldn't otherwise get.
Okay, the approved solution that non-custodial staff may use in the schools is top clean. Okay, so we already mentioned that. Well, we have MSDS on hand. I believe you should. Again, Chris, Amy.
Yeah, we'll have SDS. We have SDS, wherever we need them.
Okay. Is there a recommended number of exchanges per hour that the health department puts out? I don't know the answer to that. Stephanie, do you happen to know the answer? We could definitely find that answer for you. Also, those links that I had shared on a couple slides previous, there's some links that'll take you right to the CDC recommendations on ventilation and cleaning. That might be a place where you could get more information, more specifics. Sorry about that. Kids' hands are sensitive. Okay, if not, water correction students are allowed. Can we? I think what I'm going to do is let you guys handle the
Handle those, yeah,
the
close to
questions
the
kind
rest.
of offline, because I'm not exactly sure what your guys' procedures are in policy. All right, so let's go ahead and move on to management of COVID-19 cases and outbreaks. We are very hopeful this never comes up, but we do want to be prepared in case it does. And I'm going to let Stephanie kind of start with I'll let Stephanie handle this section. So first part is just what to do if someone develops symptoms while at school.
Right. And some of this has been talked to. The idea, again, is somebody, shows up at school, they were fine with their attestation, and then symptoms start to appear. The importance of quickly isolating that student or staff member, basically telling the staff member to go home, getting that student into isolation so they can get picked up and taken home. Again, the biggest thing here is that follow-on step should be to get tested. If that parent or guardian can get them to get tested, and that's part of having a testing plan in place. So then we kind of know what we're working with, right? Is it just another influenza-like illness, or is it actually COVID? And so the biggest thing there is that piece, and that kind of alludes back to that initial flow chart that I showed, kind of in those two columns of symptomology happening. So what that would look like. If they do get tested and their test comes back at negative, that's again 24 hours since their fever has resolved, as well as their symptoms have improved, and they were not considered a close contact to a COVID positive case. We'll get them back into school environment. And then, of course, if it does end up being positive, or they don't end up getting that test, they will be excluded from school for at least 10 days. And then again, needing that 24 hours of fever have passed and symptoms have resolved or improved, sorry.
Whichever's longer.
Yeah. Hold on, my thing's going. Okay, so the biggest thing is really working with positive cases that have been identified, for the most part, based on how tests are done, and we know we get notification as a communicable disease that those tests are positive. We should be the first people that find out here at Public Health, realizing that, if they do get tested outside of the county, particularly in another state, sometimes that reporting timeline can lag a little bit. We do have a pretty good relationship with Clatsop Public Health on that side, as well as the providers over there. And so that back and forth is really important. And we've been maintaining that throughout this pandemic. The big piece here is that what's going to happen is Public Health will come in and really assess this first, if it's one positive case, what that looks like. Every case has looked different. No case looks the same. We got to first understand where this case was, what their close contacts look like. Did it happen while they were in the school environment? Those pieces again, but we'll be in contact with the designated persons at Ocean Beach School District to kind of allow for that communication to happen. And again, that's kind of what this is just demonstrating, the contact and tracing information that we will pull from that COVID liaison at the schools, so that we can start really hammering down who all those close contacts. Obviously, with kids that are of a younger age group, it's going to be a little bit more on what that teacher observed, who they might have interacted. So there's, again, varying levels of this based on the age of the student or the staff person too. So again, that's kind of the idea of just one positive case. And sometimes it stops there. Sometimes it's a one positive case. If not, though, and we have basically two positive cases that occur in the shared location and are non-household members, that's when we would look to see, okay, how do we progress to ensure the proper precautions are taken, because this would now be considered an outbreak. Again, some of this will really depend if it's in a, very different, as you guys have already alluded to. Something in a high school is going to be a lot more impactful with their inability to cohort and have much more close contact potential than, say, maybe a student that comes in for only a certain amount of special services from 2 staff members and then goes home for the rest of the day. It looks very different depending on what this could be. But the biggest thing is really working with the school district and the school to understand where we're going to progress. Testing capacity, we will talk a little bit more to that, but just realizing that if we do have to do kind of a widespread response of testing, we have that capability in Public Health to come and do with our mobile testing team. And so that's something that we might consider as just a precautionary measure, depending on where this initial cases were, their spread of potential close contacts, and that piece there. So again, a lot of variation can happen, but there really is the communication piece, and then the movement forward with what the testing looks like, or what those close contacts being put into quarantine will look like. And then that's the piece there. You see kind of on the left, there's some of these really what is closure of classrooms look like, what does a closure of a school look like, and that is something that will be worked through with the district and school administrators to really understand where we are. Again, if we put a large contingency of the high school into close contact quarantine, you might just have to close the school because you won't have enough faculty or whatnot to be able to actually function. So it's a very varied response there potentially when we look at an outbreaks control
And
system.
it's likely, if we do have an outbreak, it's likely we'd probably recommend at least some level of all school closure, just to give us time to figure out what's going on. So we would likely recommend at least a couple days if there was an outbreak, just to give us the time to figure out and do that contact tracing. Just again, out of abundance of caution, just because you guys are a congregate setting, and we'd rather kind of be safe than sorry on that. However, prolonged closures would be more specific to the situation and really depend on, you know, who that student or teacher was around. Also, things like how good were they about adhering to mask wearing, social distancing, all of those factors come into play as well.
For sure. And so again, this is kind of what that visual diagram shows, really that coordination here with us at Public Health, the communication piece, as Katie just alluded to, that potential closure for a short couple day period to just determine what the spread might be, you know, depending on what our testing capabilities. And I say that, you know, in a context right now where I feel very comfortable in our testing capabilities, but we all know that as all states potentially start seeing increases and the throughput through labs, that can delay us a bit. And it did in basically July and August. We saw some long delays. Instead of a 2 to 3 turnaround, we were seeing, you know, 8 to 9 days to get those test results back. Again, the piece around cleaning and disinfecting because of the known COVID case or multiple cases in those areas. And then really that extended dismissal potential based on what's really unfolding in the situation at that location. And that's really it. Some into returning school. You're going to see this. This is like the third time, right? So it is really a very useful diagram. This is what we use in public health. This is what I really do recommend everybody become familiar with and kind of understanding. I'm not going to go through them again, but really what those timelines determine on that return to school, whether you were positive, not positive, a close contact, symptoms, no symptoms. It can get messy really quickly. And so this chart really does help keep it very clear on what those steps are going to be. And as Katie had stated, anyone that's acknowledged or recognized as a close contact or a positive case will be monitored by public health. We check in with them daily, every day. And so that's, again, once we know when they're up with their time of isolation or quarantine, those letters to resume are provided. For testing locations, so the biggest thing is here to have a plan for yourself, for your spouse, for your own children, help the parents to understand it's important to have a testing plan because again, you know, if a kid has a cold, vice COVID, we don't want them having to sit out for 2 weeks of school as long as their fever, you know, improved in 24 hours or went away, in 24 hours and their symptoms improved, they can come back into the classroom with a test. So the biggest thing in South County right now, it's pretty much with established patients here at OBH or the OBH clinics at Family Health Center. You can also get your test there if you're an established patient. This is another just reminder of having people have an established primary care doctor somewhere. It's really important. We are also doing drive-through testing as an access point for here in the South County because there has been, you know, again, you have to be established patients. We don't want that to be the barrier of people getting tested. So you can come through our drive-throughs on Tuesday or Friday. Across the way, CLATSUP does theirs on Mondays and Wednesdays. Public Health is another where you can get into. And then, of course, there's through urgent care if you are a patient over at CMH. For sure, down here in the South County. So those are where those testing options are. We are looking and we're hoping to have something that's a little bit more easily available. As soon as we get those plans, we'll be sure to be verbalizing them out to the community as well. So just a quicker, because we are only twice a week down here at the South County facility, and we'd rather it be an everyday availability, especially during school. And that's it.
All right, and this is the last section. We do actually, a requirement is that we do a little quick training on what it means to be a high risk somebody who is at a high risk for complications from COVID. And we need to take this slide out, Stephanie. It's a very boring video. I'm not going to torture you guys with it. Go to the next slide and we'll just cover the topic area here. But basically, there's two categories of people or sets of conditions. The first set is going to be people who are at an increased risk of developing severe illness from COVID. The second slide is going to talk about people who might be at an increased risk. So this first group is kind of more, the research is a little bit more solid that these are actually definitely things that are going to put you at an increased risk, versus the second one is like probably, but the science isn't quite there to the same extent as this first slide. So people who are going to be at an increased risk of severe illness from COVID are people who are over the age of 65, people with cancer, chronic kidney disease, COPD, obesity, and that should be BMI over 35, not 30, serious heart conditions, sickle cell disease, and type 2 diabetes. The second slide is going to be people who might be at an increased risk for severe illness from COVID. So we're looking at asthma, cerebral vascular disease, cystic fibrosis, hypertension or high blood pressure, an immune compromised state. So there's a list of kind of reasons there. Generally, it's people who use immune weakening medicines, neurologic conditions like dementia, liver disease, pregnancy, pulmonary fibrosis, smoking, thalassemia, and type 1 diabetes. Now, the reason we want to mention this is, number one, it's a requirement that people are sort of made aware. If they do happen to be a high-risk employee, it's important that you are aware of that. And then it also is going to give you certain rights, which is on the next slide. So these are kind of the frequently asked questions regarding employees' rights. And in particular, people who are high risk in terms of their employment. This information generally comes from L&I. So as an employer, the district's required to provide a safe and healthy work environment, and you do have certain protections under L&I. First question is, can a high risk employee choose to come to work without additional accommodations? So if that is the person's choice, the answer to that question is yes. The employee does not have to identify that they're high risk. And even if they do, they can choose to engage in regular employment. Question number two, can a high risk employee ask for additional protections? The answer to that is yes. And the district should follow existing L&I guidance. It's longstanding guidance that talks about workers' rights if they feel unsafe or if they have high-risk conditions. The district is required to provide reasonable accommodations. That does not mean that they have to accommodate unreasonably. So it needs to be something that they can reasonably do. If they can't reasonably accommodate, then that would be an unreasonable accommodation. There's a lot of guidance specifically at the L&I site around this, and this would be treated just like any other kind of work-related accommodation due to like a disability or a health condition. So COVID isn't special in that regard. It would be handled the same way. Can high-risk employees ask for alternate work assignments if additional protections cannot be provided? And again, they can, and L&I guidelines should be followed. Again, the accommodation needs to be reasonable. So it's not an automatic accommodation, but the district should make attempts to accommodate where possible. If a high-risk employee cannot be provided additional protections and there are not alternative job assignments, can the employee access eligible forms of leave? So like sick, vacation time, that sort of thing, and the answer is yes. And then the last question, are school districts required to provide an accommodation to employees if they are not high risk themselves, but they live with someone who is? And the answer to that is no. The L&I protections only extend to the employee, not their household members. All right, next question. Or next slide, I'm sorry. I was reading that comment, making me laugh. Okay, we'll go ahead and go up and hit some of these questions. I think I missed the one about the bottle fillers. If you can't use bottle fillers, where are you supposed to get water? I'm gonna let your administration handle that one in terms of what their decision is on that. Amy, do you wanna?
Chris and I will have to talk.
Okay, figure that out. I mean, there's ways you could probably have that open. You just need to really make sure that you're staying up on cleaning and sanitizing around that, and maybe just open to staff. Yeah.
We are doing that, so my guess is the answer will be the bottle fillers are fine. But drinking fountains, no drinking fountains.
Yeah, okay. All right. Let's see. If 40% of people are asymptomatic, what is the procedure for contact tracing when you may not be able to identify the initial carrier due to being asymptomatic and they are still in the school? So the person who would be considered the primary person would be whoever had that positive test. Sometimes it is impossible for us to tell where the person who tested positive, where they got COVID from. However, it would be likely that other asymptomatic carriers would be identified as close contacts in that situation. And they wouldn't have to have symptoms in that scenario in order to get a test. We would actually recommend anyone who is a close contact of a positive case get tested, even if they have no symptoms at all. It's also possible that we would do some more widespread testing if there was really a broad outbreak at the school. If we really can't figure out and we're not sure that we've contained and really contact traced, that might be a scenario where we do some additional testing that we wouldn't normally do just in the general public. But yeah, I mean, it's definitely true that a lot of people can and are walking around as asymptomatic carriers. That's again why it's so important that we wear our face masks and we social distance, even if you feel fine, because you definitely could be an asymptomatic carrier and you could potentially be spreading that to other people. So if you're wearing those face masks, you're doing the social distancing, you're really going to reduce the chance that you are spreading to other people.
Yeah, so with that like vector identification, that tends to be a hard piece of this. That's why when we scoop in those close contacts, we're really trying to figure that out. The piece there too is that, we have a timeline we're working with. That vector might have been at their end of transmission or incubation period, and then we test them as a close contact and they test negative, but we're like pretty sure that was the person because that was the main change in that person's routine, So there's a lot of pieces to the case investigation and the overall contact tracing. Again, with those efforts to really limit that spread within that catch of close contacts. And if we do that well, and if we do it quickly, that's the piece that is really critical. That's why it's been nice up in the North County. We've had access to a rapid screening machine that has been really helpful. And we're really hoping we'll get one down here in South County that can help us with that screening piece. Because if we can get people that same day that we get acknowledgement of a positive case through at least a screening component to capture potential of their infection level, because again, you will have it for at least 2 to 3 days prior to being symptomatic if you do show symptoms. So again, timing and that timing is critical.
Yeah, and I will tell you, our public health nurses have, a combined probably 60 years of public health experience. They're very, very experienced and they're excellent contact tracers, really good at digging and kind of doing the investigation work. It really is kind of like investigating a crime. I mean, you follow leads and you figure things out on all different levels, and they do a very good job. We're not 100% identifying the root cause of every illness, but they do a pretty good job. And we would obviously be just as diligent with anything that happened at the school, if not more so. I think generally speaking, we're going to be more cautious with school cases than we would even with the general public in terms of contact tracing and isolating and quarantining people, in abundance of safety. All right. I don't see any of the questions other than just being middle-aged and chubby count. So, that is a funny question. So anyway, does anybody else have any other questions? Anything we didn't answer? We are happy to take your questions anytime after this presentation. Contact us at the health department. You can catch us at the EOC number at 642-9407, Monday through Friday, 8 to 4. We're happy to answer questions, give you data. Even if it's weird, we get all kinds of weird questions constantly. We don't always know the answer to them, but we have access to Dr. Kreger. He's very good about getting back to us, and he, generally speaking, he can come up with an answer, when we get stumped. So again, we're happy to do that. And just know that we're here to support you guys. We know this is a really big lift, and we're wishing you the best of luck. And and anything you need, just let us know. And I think that's it for us.
Thank you, Katie.